Dr. Parker, tell me about arm contouring.
When we evaluate a patient for their concerns about their arms, I'll have them stand in what we call the goalpost position, and I'll carefully examine their arms. And what I'm looking at is they have fatty tissue here as the quality of their skin. If they have excess fatty tissue in the arm and they've got good skin tone, we can do liposuction, typically through a tiny incision that's hidden here at the elbow and one in the armpit. Knowing the skin is in good shape, the skin contracts to conform to the shape that we've created. And the patient has minimal scarring. It's a minimal procedure, can even be performed under local anesthesia. If they have some loose skin, but it's moderate, we can perform what's called a short scar arm lift, which is making an incision in the armpit area, tightening the skin and lifting it this way. So we hide the scar in the armpit area, but they need a relatively small amount of loose skin. We can combine that with liposuction. We can even combine that with BodyTite. So that's a minimally invasive procedure. Again, can be performed under local anesthesia, and there really is no visible scarring. As we kind of travel down the pathway, patients who come to us and have had more significant weight loss, and now they have really significant loose or hanging skin, they need what we call a classic arm lift or a classic brachioplasty. What that entails is us designing an incision along the lower aspect of the arm. Part of the planning for the procedure is grasp the skin above and below that intended incision line. And in the operating room, we remove that extra skin, sometimes fatty tissue as well, with liposuction. That leaves the patient with a scar from here to here, but it creates a much improved contour of the arm. We're very focused and try to hide the scar on the inner aspect of the arm, so that when patients have their arms at their side or they have them up, it's in the least conspicuous area.